In this video, I'm going to demonstrate how I use a CO2 laser to perform a lingual frenectomy for treatment of ankylosing. The patient is a healthy 16-year-old young man who presented to my office for removal of his impacted third molars. On clinical exam, it was noted that he had a moderate degree of ankylosing, and on further questioning of the patient and his mother, we found out that in his youth, he had a mild speech impediment with difficulty with the S and L sounds, for which he had speech therapy. This improved slightly, but not completely, and still persisted at age 16. In addition, on the lingual aspect of teeth number 24 and 25, there was some gingival recession, and if you put some tension on the frenum, you could actually see the lingual mucosa, attached mucosa, pulling away from these teeth. Both of these are indications for doing this procedure. A third one would also be if the frenum was continually traumatized either by food or with rubbing against the incisal edge of the lower incisors. So the procedure begins by giving a local anesthetic. What we do is we grasp the tip of the tongue and give some local at the very tip of the tongue. We're using 2% lidocaine with 1 to 1,000 epinephrine. And then we grasp the tip of the tongue and using a 3/0 silk suture on a needle, we'll pass that through the tip of the tongue, and this is actually used for retraction and tension on the tongue. So we'll cut the needle off and then tie a knot to use that as a retractor. We're going to give some local anesthetic now. We're going to start at the base of the tongue, right under the frenum, and go into the body of the tongue a little bit, and then also give some local anesthetic on the portion between the mandible and the sublingual fold, so the most inferior part of the tongue. So we have our CO2 laser set at 5 watts of continuous energy, and we're going to start at the most inferior portion of the frenum and then spread that with our finger at each pass. We only need to do a couple passes there to cut the fibrous bands in this portion, and then we're going to go to the base of the tongue towards the tip above the sublingual fold. So with each pass, we're cutting through the fibers of the frenum and then blunt dissecting with our gloved fingertip, and then repeating the same thing again. With this technique, we're actually doing a minimal amount of cutting, and as such, we don't need to suture. So what we're going to do is we're going to create a char layer over the exposed, over the lased area that will then kind of seal the blood vessels and nerve endings and allow for healing by secondary intention. So we're going to turn the laser down from 5 watts down to 3, and in a defocus mode, we're going to do a pass over this area to create a char layer, which is essentially a laser cautery. We're going to do the same in the section above the sublingual fold. In this case, we're going to just be going lightly over the area that was excised. We also have that small tissue tag at the most superior aspect or close to the tip of the tongue, and we're going to ablate that with the laser with a little more aggressive tissue removal. Once we verify that we now have good mobility of the tongue, we're going to go ahead and remove the suture and then just inspect what we've done to make sure that there's no bleeding. And if you so desire, you can take a 2x2 gauze and moisten it and roll it up like a sausage and stick it underneath the base of the tongue and send the patient home like that. Post-op instructions are pretty basic. We have the patient start with warm saline rinses as often as they'd like, starting the evening of surgery. We also start them on a chlorhexidine rinse twice a day, starting the morning after surgery, which they do for about a week. We have them back for follow-up at 1 week, and at that appointment, we show them some tongue exercises to prevent contraction and scar band formation where we did the frenectomy. Basically, this consists of having the patient stand in front of a mirror and stick their tongue out straight as far as they can towards the mirror and hold it out that way for approximately 10 seconds, and to repeat this same procedure 10 times. They're to do this 3 times a day, and then we see them back for follow-up again 2 weeks later. That's generally the last time we need to see them, and at that point the procedure has completely healed and the patient should have pretty good tongue mobility at that point. Some patients may need some speech therapy post-op because they've become so habituated to having their tongue tied, but this is not always the case.